Do anticoagulants cause diverticular bleeding? Imagine a tiny pocket in your colon while suddenly bleeding heavily. That's what happens during diverticular bleeding, a common complication in people with diverticular disease. But does taking blood-thinning medications make this more likely? Let's explore the facts. Diverticular disease involves small pouches called diverticula forming in the colon wall. When blood vessels near these pouches rupture, it causes significant bleeding. This is especially common in older adults. While having diverticula alone usually doesn't cause bleeding, certain factors increase the risk, including high blood pressure, obesity, use of non-steroidal anti-inflammatory drugs, and, importantly, anticoagulant medications. Anticoagulants are drugs that help prevent blood clots. They are often prescribed for conditions like atrial fibrillation or after certain heart surgeries. Common examples include warfarin and newer drugs called direct oral anticoagulants, or DOACs, like Apixaban, Rivaroxaban, and Dabigatran. These medications are very effective at reducing clot risks but do have some impact on bleeding. Scientific studies show that people taking anticoagulants have a higher chance of experiencing diverticular bleeding compared to those not on these drugs. This increased risk is independent of other factors, meaning anticoagulants alone can raise the likelihood of bleeding episodes. Interestingly, the risk appears similar whether someone is on warfarin or a DOAC. However, it's important to remember that the overall increase in risk is modest. Large reviews and studies indicate that while anticoagulants do raise the chance of bleeding, the overall rate of diverticular bleeding remains relatively low. For example, some research shows no significant difference in bleeding rates between different types of anticoagulants. If someone has already had a diverticular bleed, the risk of it happening again is higher, especially if they continue taking anticoagulants. But stopping these medications can increase the risk of serious blood clots, like strokes. This makes managing anticoagulant therapy after a bleed a delicate balance. For people with diverticular disease who need anticoagulants, it's crucial to work closely with healthcare providers. They can help decide whether to adjust the dose, temporarily stop, or continue the medication based on individual health risks. Factors like the location of diverticula, use of other medications like NSAIDs, and overall health influence bleeding risk. For instance, bleeding from diverticula on the right side of the colon tends to be more common. In summary, anticoagulants do increase the chance of diverticular bleeding, but this risk is generally low. The decision to use these drugs should always involve careful medical guidance. If you have diverticular disease and are on blood thinners, don't stop or change your medication without talking to your doctor. The goal is to protect you from both bleeding and dangerous blood clots. Always seek personalized advice from healthcare professionals to find the safest plan for your health.